I'm still sick. Yeah. Yeah. And nobody cares. It's very sad. I know. And yeah, I know. It's ridiculous. But I got coffee. What's that? Yeah. Their what? Will their pulse ox go down? Does this person have congestive heart failure? Maybe their congestive heart failure is getting worse. Right?
My mom a week ago. It's her Friday.
Holy cow.
Oh crap, right? Medicine's an amazing
That's
thing.
it's incredible. She's off the ventilator and everything, huh? She got fever?
Her kidneys are coming back.
Oh, really? Yeah, she's how old is 62, right? I mean, that's like my age.
Getting albumin and waiting out. She is going in for surgery again today to check out her bowels and stuff, but her blood pressure is too high now. So it went from couldn't even regulate it to she can't keep it down. I think a lot of it's pain and stress.
Yeah. Yeah.
Her heart's still all over the place. AFib, but she was having no T-wave, like her T-waves were very long and prolonged, but her calcium, her potassium was good. So it's just kind of
You know, it's amazing that, like, you know, people will get better or worse in spite of what medicine does, you know. If she was meant, you know, she was meant to get better.
Well, I think
Yeah, that's nice. Good, I'm glad to hear that. She's so young. No. Yeah. Yep. Because you don't want that to happen, you know, like while they're on a table or something like that, you know. You know, that will to live, you know, is very strong. Yeah. Yeah, again, they typically give you the worst case scenario, then. Mhm. All right. Okay, let me get my act together. That's going on. Let's see. This Saturday, and for the next 3 Saturdays, I will be here from 9 until noon. I will be selling AMP juice and Polish out of the back of my Jeep. For review, okay? If you want to come, I'm coming in from my general class because I'm giving them extra time for their lab final on Saturday. So you don't have to show up. Just letting you know it's out there. Yeah? All right. Okay, we're going to finish up the kidney today, and then we're going to start the lymphatic system, immune system. Yeah? Okay. Hey, have you ever seen this movie, Unforgiven? Let me tell you what it's about real quick. Back in the Western days, there's Clint Eastwood there. He's got a Springfield rifle. Anyways, he used to be a really bad dude. Like, he would go around and rob trains and kill women and children, right? And then he got married, and this woman straightened him out. But anyways, he gets hired to kill these cowboys who cut up a prostitute. Took a knife and just chopped her up. So all the other prostitutes hired these guys to kill these cowboys who cut her up. So what they're doing is they're hiding in the bluffs over here, and then they're trying to shoot the cowboy, right? So hang on, let's see if this will work. Okay, wait. Why isn't it working? Hang on. Oh. Okay. All right, so watch. They're trying to...
Reload this. You missed him. I got him. He ain't killed. Maybe, maybe not. Got him through the gut, I think. You think he's gonna die? You think we killed him? Yeah. We killed him, I guess. I'm dying, boys! I think you shouldn't have cut off no woman, you asshole! Jesus, I'm so thirsty. Slim! Slim, give me some water.
Why do you get thirsty? Huh? Here we go. Okay, I'm going to go over antidiuretic hormone. Yes? What am I going to go over? Yeah. That's what I'm doing. I'm hitting it right now. Yeah, go there. Uh-huh. Bless you. That sounds like a boomerang. Okay, remember we talked about this on Wednesday. We talked about the fact that as you move deeper and deeper into the cortex of the medulla of the kidney, the nephron, as you move deeper from the cortex to the medulla, what happens to the osmolarity? It goes up, right? Now watch, and I explain this to you. The collecting ducts that ultimately drain what is soon to be urine into the calyx of the kidney, yes? This is impermeable to water. So it's impermeable to water. And in the absence of any hormones, it's going to just cause all the water that was in that collecting duct to ultimately end up in your urine. You got me? All right. So this is what happens. And this is from quiz number 1. Ah. Hi, Jessica. Yeah, I'm going to wrap it up. Yeah, it's all coming back to haunt you. Ready? One of the things the H-style controls is osmolarity. Do you remember that? And if you remember, osmolarity is stuff to water. Do you remember? You remember this? Okay. And embedded in the H-style, you got these little osmoreceptors. And sodium and albumin determine the osmolarity of the blood, and potassium determines the osmolarity inside the cells. All right? So watch. We also learned that there are pressures that can cause fluid to move into and out of the cardiovascular system, right? There's capillary fluid pressure, which tends to force fluid from the capillary into the interstitial space. And then you have interstitial fluid pressure, which tends to force fluid from the interstitial space back into the capillary. And under normal physiologic conditions, capillary fluid pressure is almost always greater than interstitial fluid pressure. And I'm going to make this statement. For the most part, systolic blood pressure determines capillary fluid pressure. So what did Davy, the prostitute cutter-upper, what happened to him? He got shot, and he started bleeding his own blood. So what's going to happen to his blood volume? Go down. What's going to happen to venous return? What's going to happen to the stretch of the right heart? Just work that go down thing. Go down. So now there's less blood in the right side, less blood to the lungs. That means less blood on the left side. And that means less stretch, less force of contraction, and ultimately what's going to happen to systolic blood pressure and capillary fluid pressure? It's going to go down. And there's going to be a point at which interstitial fluid pressure becomes greater than capillary fluid pressure. And it's going to force fluid, wah-wah, from the interstitial space into the capillary in an attempt to maintain blood volume. Do you see this? Now, we talked about this. What are the two ways that you can increase osmolarity? That's right. I'm going to write that out. That's very important. Yep. So to increase osmolarity, there's two ways you can do it, right? Number one, you can keep the stuff the same and decrease the water, or you can increase the stuff and keep the water the same. That's how you increase osmolarity. So what are we doing in this case? In this case, we are keeping the stuff the same, but we're decreasing the water. So what's going to happen to the osmolarity? It is going to go up. So you better write this down. You're going to have increased osmolarity. And that's going to be sensed by those little osteosmal receptors in the HDL. And what gland is directly connected to the hypothalamus? The pituitary gland. So you better get this right. Watch. The hypothalamus will make the hormone ADH, and it will transfer it to the pituitary gland. What part of the pituitary gland releases ADH? The posterior pituitary. Yep. So, watch. Why were the osmoreceptors stimulated? So but that was an increase in osmolarity, right? So you got your HDL, and then you got the little dingleberry, the pituitary gland. But this is the posterior pituitary. And remember, hormones that are made in the hypothalamus are released from the posterior pituitary. So you make ADH in the HDL. It's released due to increased osmolarity. It's transferred to the P. Diddy, and then ADH gets dumped into the blood. And as the name implies, ADH is anti-diuretic. What does a diuretic make you do? It makes you whiz, right? Anti-diuretic is going to make you not whiz. So watch. The most prominent effect of ADH is on the collecting ducts. And what it will do is it will cause the cells that make up those collecting ducts to insert water channels. So as ADH is around, it's going to begin to insert these little water channels into the collecting ducts. And as a result, that water that was going to get peed into the toilet now gets reabsorbed back into the blood. So what will happen to somebody's urine output as a result of them bleeding their own blood? It will go down. Say yes. You got that. Now, watch. If you look here, you got this guy right here. Here's the collecting duct, right? And then here's the calyx of the kidney. And again, if you make these little lines of osmolarity, right, as you move deeper from the cortex in the medulla, the osmolarity goes up, right? So there's more stuff and less water. So as this guy begins to bleed his own blood, that's going to decrease blood volume even more, stretch, force of contraction, and capillary fluid pressure is going to continue to drop even more. If that's the case, what's going to happen to the osmolarity as a result of him continuing to bleed his own blood, it's going to continue to go up. And as it continues to go up, more and more ADH is released into the blood. And the more and more ADH that's released, it will start to insert these water channels lower in the collecting tubules. And because the osmolarity goes up as you go from cortex to medulla, that means more and more water will get reabsorbed. So with maximum ADH secretion, you get no urine output. Say yes. And there's two diseases that are associated with ADH, and you'll learn about these when you get into clinical, right? With ADH, there is one. Diabetes insipidus. How do you spell that? That ain't right. There's an I. Insipidus. With diabetes insipidus, there is no ADH. And there is, the second one is syndrome of inappropriate ADH. And that is where you have increased amounts of ADH. And ADH deals with free water only. It doesn't affect electrolytes like aldosterone does. It's simply free water. Say yeah. And I explained this to you. Alcohol inhibits the ADH's ability to insert those aquaporins in the collecting duct. That's why when you have a little tussle with the bottle, Laura, do you drink?
No.
You got to learn to lie better than that. That was awful. Watch. That's why when you first pee, it's yellow, but then your subsequent pees are clear because alcohol inhibits antidiuretic hormone. My buddy, he thought he was going to get out of having to buy beer at County Stadium. He tried making beersicles. Well, if you remember chemistry, water has a higher freezing point than alcohol. So he had a popsicle of water, Harley, and hops, and a little bit of alcohol on the bottom that hadn't froze yet. Yep. You're an idiot. Tell me you got that. That's the effects of antidiuretic hormone. Write this down. The medical term for antidiuretic hormone is called vasopressin. Boom. So if someone's getting vasopressin, they're getting antidiuretic hormone.
How long will those aquaporins be?
Until the osmolarity starts to return to normal.
Okay.
Yep. Yep. So ADH actually stimulates the cells that make it up, that will stimulate enzymes that will cause that protein to be built. And those little aquaporins are proteins. Isn't that wonderful? Yeah, look, taking you full circle, Sister Sledge. Yep. Okay, that's ADH. We went over the renin-angiotensin-aldosterone mechanism, right? Okay, just real quick, I want to explain to you ACE inhibitors. And I know I went over this. I didn't go over ACE inhibitors, right? Okay. If you recall, angiotensin 1, that lasts for about 30 minutes, right? So the big problem is when angiotensin 1 gets converted to angiotensin 2. And what converts angiotensin 1 to angiotensin 2? ACE, angiotensin converting enzyme. So angiotensin 2 does two very powerful things. It's a massive arterial vasoconstrictor, and it causes the release of the hormone aldosterone from the adrenal cortex, right? So aldosterone is what's referred to as a mineral corticoid. What that means is that it messes with electrolytes. Cortisol, which is also released from that messes with glucose. So that's why it's called a glucocorticoid if you read it in your book. Did you read that in your book, Jessica? No? Okay, good. See? All right. So we're moving on. All right. So watch. ACE inhibitors inhibit ACE. Are you writing that down? Please. So watch. If you don't make angiotensin 1 into angiotensin 2, will you get the release of aldosterone? And what does aldosterone do in the nephron? What does it do? That's right. Aldosterone stimulates the sodium-potassium pump in the distal convoluted tubules, right? So, watch. Here's the little pump. Whoops, that's an eraser. Here's the little pump. And it will take 3 sodiums and it will pump it into the blood, and it will take 2 potassiums and pump that into what's soon to be urine. And when you pump the sodium in, what follows by osmosis? So by inhibiting the renin-angiotensin, you're inhibiting that angiotensin-converting enzyme, you're preventing the effects of aldosterone. So what will happen to their blood volume as a result of taking an ACE inhibitor? Your blood volume will go down. Say yes. And because your blood volume goes down, venous return, I can't even do it anymore, zop, zop. You got me? And watch. What electrolyte do you have to worry about when someone's on an ACE inhibitor? Do you have to worry about potassium being high or potassium being low? Think real hard. If you inhibit the sodium-potassium pump, do you pump the potassium out? No. So one of the things you have to watch with people who are on ACE inhibitors is an elevated potassium. Because write this down, tattoo it somewhere. The only way that you can get rid of potassium is to pump it out of the blood. And the only thing that really pumps potassium is the sodium-potassium pump. Yeah. You got me? So, watch. Hang on. So by inhibiting angiotensin-converting enzyme, you inhibit the release of aldosterone, and you also will cause arteries to dilate. And if arteries dilate because you're inhibiting the production of angiotensin 2, what's going to happen to resistance to arterial blood flow? It will go down. So what will happen to your systolic blood pressure? It will go down. So ACE inhibitors decrease preload and afterload. And if you recall from our discussion of congestive heart failure, I explained to you that in people with CHF, you want to make sure that you decrease their preload, so you give them diuretics, and you decrease their afterload by dilating their arteries. That's why everyone with dilated form of congestive heart failure is on or are on ACE inhibitors. Say yeah. And what? They're called ACE inhibitors. And they end in pril. Lisinopril, captopril, minoxidil, pril, ill. Vasotec. Get it, Vasotec? Now watch. Where's ACE located? In the lining of the pulmonary capillaries. I'm not going to get into all the chemistry, but ACE inhibitors can cause little inflammation of the alveoli, and it will produce a dry cough. So one of the big side effects of ACE inhibitors is a dry cough. And people don't like to cough. They want to read the textbook. So watch, and this is the important piece. And I'm going to write this down, it's so important. In order for angiotensin II to cause massive arterial vasoconstriction, what's an artery mostly made out of? That's right. So if this is the lumen of the artery and this is the muscle, in order to exert its effect, angiotensin II has to bind, you're not going to believe this, to an angiotensin II receptor. Oh. And that's going to cause that artery to constrict. So they came out, probably in the last 20 years or so, they came out with angiotensin II receptor blockers. So you don't inhibit ACE, so angiotensin II gets formed. But in order for angiotensin II to exert its effect on the body, what does it have to bind with? An angiotensin II receptor. So they came out with a new drug called angiotensin II receptor blockers, or ARBs. Did you ever hear of ARBs? You did? See? I'm not making this stuff up. Not even at all. Those are also the things that on those ghost shows that come into you and then make you start acting crazy. These little balls. Called ARBs. It does. So hold up. Whoops. So in order to exert its effect on the adrenal cortex, angiotensin II has to bind to angiotensin II receptors. Ain't that nice? A2 receptors. And when angiotensin II does that, that's going to cause the release of aldosterone. So they give them an angiotensin II receptor blocker, and that prevents angiotensin II from binding to the angiotensin II receptor. So you don't get the release of aldosterone. So the effect is the same, the mechanism of how you block it is down the road. Say, yeah. You got that. How many people are with me? Okay. Bam. All right. Okay, now I'm going to go over A and P. Okay, watch. Hang on.
Your heart is a pump.
Oh, yeah. It'll wake you up. Okay, here we go. Here we go. If you increase your blood volume, what happens to venous return to the right side of the heart? Good. You know what I'm going to do? I'm not even going to say that anymore. I'm just going to hold my thumb up. That means stretch, force, contraction. If it's lower, then I'm going to put my thumb down. Then you got me? Okay, so watch. When you increase your blood volume, That's going to increase venous return to the right atrium. Inside the right atrium are specialized cells, and those specialized cells respond to stretch. Hang on. How do you stretch your right atrium? By adding more blood back to it, right? So these specialized cells, when they're stretched because of increased venous return to the right side of the heart, it will release into the blood a hormone called atrial natriuretic peptide. An atrial natriuretic peptide has its effect on the nephron. Now, think about it for a minute. Think about it. If you have increased venous return to the right side of the heart, what's going to happen ultimately to your blood pressure with a normal heart? It's going to go up. So you want to maintain homeostasis, don't you? Sure. Who doesn't? So as a result, you're going to get that AMP released, and the function of AMP is diametrically opposed to aldosterone. So I want this. So when AMP is around, AMP inhibits the sodium-potassium pump. So AMP prevents the pump from pumping 3 sodiums back into the blood and 2 potassiums out. So what is the result? If the sodium remains in the distal convoluted tubules, what's going to stay along with it? So what's going to happen to the amount of urine you produce? It's going to go up. And what's going to happen to blood volume then? So what's going to happen to venous return? And then because there's no more stretch of the right atrium, there's no more signal. Fine, positive or negative feedback mechanism. That is AMP. And AMP is the only hormone in the body that lowers your blood pressure. All your other hormones raise it. Yeah? Can I show you something clinical? Can I? Okay. I'm going to show you. Hang on. I'm going to show you. I promise. Where is it? Oh. Okay, watch. Here's a normal left ventricle, all right? And here is a dilated, weakened left ventricle. You got me? So in a normal heart, if you increase venous return to the right side of the heart, watch. In a normal heart, right? If you increase venous return, you are going to stretch it so the actin and myosin are going to line up better. So what's going to happen to the force of contraction of the heart? It's going to be greater. Say yes. In a person with a damaged heart, where the heart is stretched out, the actin and myosin are as good as it gets. It don't get better than this, right? So if you add more venous return of blood to the right side, more blood's going to go to the lungs. Now more blood's going to come back to the left side, and it's going to overstretch it. In a normal heart, does your ventricle ever get overstretched? No. But in a person with CHF, it will get overstretched. And when your left ventricle becomes overstretched, specialized cells within the ventricle release into the blood BNP, brain natriuretic peptide. BNP was first isolated in sheep brains. That's why it's called BNP. But BNP has the same effect on the kidneys as AMP does. What's it going to do? It's going to inhibit the sodium-potassium pump, prevent sodium from being put back into the blood along with the water, so you will pee out more sodium and water. So one of the blood tests that is monitored in a patient with congestive heart failure is the brain natriuretic peptide. And the reason that BNP is monitored is that if it's going up, that means your ventricle is becoming more and more overstretched. And that means that your congestive heart failure is worsening. How many people even came close to following that? So one of the blood tests that they can use to determine the state of your congestive heart failure is a BNP. So if a person with congestive heart failure came into the emergency room and they're having shortness of breath, I'm having shortness of breath right now. But do I have congestive heart failure? I hope not. But if a patient with congestive heart failure does come in, a doctor can rule out or differentially diagnose between an exacerbation of their CHF, the CHF is getting worse, or it's something else. So if their BNP is going through the roof, then you know that their CHF is getting worse. That's, again, another way a blood test can determine how an organ is functioning. Say yeah. Does that make sense? Makes perfect sense. Okay. Hey, can you indulge me just for a second, please? Let's see. I'm not sure.
So, what is the difference between
Hang on.
a heart failure drug and your electrical conductivity drug, or your hypertensive drug versus
It's 9 minutes. 9 minutes.
drugs that cause decreased chronotropic and
I can't even take that.
your heart has
Hang on.
so pressure, also known as workload.
What's that?
So
How do you speed it up?
let's just say you went to work, okay?
Huh?
And you're a accountant.
Oh,
How many accounts
hang on. Tough.
have you done in that day? Let's just say you're balancing books or you're doing someone's taxes. How many clients have you done in an hour? How many accounts have you kind of closed in an hour? That's your rate, okay? But how much pressure, how much work does it take to close one account? What if some accounts are like really, really small, you just make 2 adjustments and you close? How heavy are these, let's say, accounts? Same thing goes in terms of, let's say you're moving boxes at Home Depot.
Hang on.
So what, your electrical conductivity as well. Your pressure and workload is really how much.
Just real quick. The reason I'm making you watch this is there are nursing instructors who recommend these guys' videos, and that they'll actually put them on their Blackboard shop. And watch how this guy makes stuff up. And you don't know what you don't know.
To push against all that pressure in the vascular system. So, which one affects your volume and your pressure? So let's go into that here. So we're going to go over volume only. Volume only here. Okay? We're not talking about rate or electrical stimuli. No electrical stuff going on here. No contractility, no electricity. So, no
Bless you.
electric.
We should get to it.
Right now. What we're talking about, contractility, no SA node, or AV node. We're not going to be talking about that right now. What we're talking about is how much volume. How much pressure is being pushed on that heart, and which drugs cause a decrease in this pressure. So, ACE inhibitors.
Wait, here it comes. Here it comes.
Also ending in pril. These guys cause your decrease in volume. It doesn't have anything to do with the rate or contractility or electricity or SA node or AV node. There's no electrical conduction with pril. It just lets out fluid. Volume only. And I did a really good job on a video called Club RAS, the renin-angiotensin-aldosterone. Kind of fun. So next, guys, let's see here, is your loop diuretic.
Okay, listen to this. Listen to this.
Also known as your MIDE drug, like furosemide.
I spelled that wrong. I can't hate on him for that. I can't spell either.
So, furosemide. Loop diuretics are like Lasix. Lasix is it's a potassium wasting diuretic. Diuretic just means that it's going to have your patient pee a lot. And it acts on the distal tubules of the kidneys, the descending loops of Henle.
That's a lie right there.
Fancy words for
He's lying, so he drinks.
little tube in the kidneys. It just lets them release fluid. It lets them release fluid from your kidneys themselves. So it's stopping your anti-diuretic hormone and releasing the kidneys. It's kind of bypassing all.
Did you hear that? It inhibits anti-diuretic hormone. See, you don't know what you don't know. Right? So watch this guy. Brilliant. An idiot. Okay. That's AMP and BNP. Say yes. ADH, I went over the renin-angiotensin aldosterone mechanism. Say yeah. Okay, what else? What else? Who's got that quiz? I did. I just...
reasons why a patient in DKA might have hyperkalemia.
Okay. Here we go. The kidneys control pH, and one of the ways, and I went over this about 1 million times, and again, I'm simplifying here. Now watch. In the proximal convoluted tubules, remember I explained to you that hydrogen ions and potassium ions have to be actively secreted from the blood, right? Bicarbonate, on the other hand, is readily filtered by the glomerulus. So in times when there is an acidosis, what the kidneys will do is they will secrete more hydrogen ions and reabsorb more bicarbonate. So if you have a respiratory acidosis, the kidneys compensate by reabsorbing more bicarbonate. You got me? Now, watch. It's here, it's in the proximal and distal, mostly the proximal. There is an exchanger, a sodium-potassium exchanger. And what they do is they take sodium and bring it back into the blood in exchange for potassium that you pee out. Now, which is more important, to maintain your pH or to maintain your potassium level? Your pH. So if the amount of hydrogen ions in the blood is going up, dropping your pH, if the amount of hydrogen ions in the blood goes up, dropping your pH, then what the nephron will do is it will trade hydrogens for sodium. In that sodium-potassium exchanger, instead of exchanging sodium-potassium, it exchanged sodium and hydrogens. Say yes. So if you're not getting rid of the potassium because instead you're exchanging the hydrogens for sodium, what's going to happen to the amount of potassium inside your blood? It's going to go up. So anything that causes, well, metabolic or respiratory, that will cause a drop in pH is going to cause the kidneys to retain potassium. That's why acidosis and hyperkalemia go hand in hand. Say yes. The other thing is that in the cells of the body, this works not as well as the kidney, but you have this potassium hydrogen ion exchanger. So when the amount of hydrogen ions goes up in the blood, this potassium hydrogen ion exchanger will exchange potassium from the cell and go into the blood, and then take the hydrogen ion and bring it into the cell. And the reason that they do that is that there are protein buffers inside that cell that can buffer those hydrogen ions. So this is another mechanism that causes why an acidosis causes hyperkalemia. The big one occurs in the kidney. The secondary one occurs in the cells of the body. Say yeah. You following this? Okay. So I use DKA as an example. But anything that causes the amount of free-floating hydrogen ions in the blood to go up, it's going to start exchanging the sodium for the hydrogen ions, so that's going to keep the potassium in the blood. And you're going to start exchanging potassium and hydrogen at the level of the cell. The kidneys will try to do that first. If they can't handle it, then you'll start exchanging the hydrogens and potassium at the level of the cell. Say yabba. So that's why when you're in clinical and they talk about acidosis, always think hyperkalemia. And what does acidosis do to neural activity? Suppresses it. And guess what hyperkalemia does to neural activity? No, you don't like that? That's good. Okay. What's next? You need another one. Oh, do you want to learn how to do that or no? Do you or no? You do? That's ridiculous. Okay, here we go. I'll just give you a couple, and then you can learn it on your own. All right? You know it. This is in third semester. This is where the registration for horticulture and welding increase. And the reason it does is people don't get it. And you're going to get it. You should know these norms. Rarely do I ask you to know numbers, but in this case, I'm not going to give them to you, so you're going to have to know them. And if you don't, that's bad. Right? So again, to remember the CO2 levels, just take the 35 and 45 from the normal pH. That's your normal CO2 levels. Right? And then, of course, you have bicarbonate. And because bicarbonate is an electrolyte, it's measured in milliequivalents Q per liter. Can you see that? 22 to 26. All right. Now, just a couple of things, and we talked about this before. Even though these pHs are alkaline, right, anything less than 7.35 is considered an acidosis, and greater than 7.45 is an alkalosis. We discussed this, yes? The only reason you look at PO2 and O2 sat is to determine whether or not these people need supplemental oxygen, right? But what really determines the person's pH is the PCO2 and the bicarbonate. And again, because PCO2 is controlled by the respiratory system, right, and bicarbonate is controlled by the kidney. So what's really important is that you understand that if one system is causing it, the other system is the only system that can compensate for it. You got me? So in a metabolic acidosis, the only system that can compensate is the respiratory system. In a respiratory acidosis, the only system that can compensate are the kidneys. Say yes. Okay. So I'll take you through one. All right? Watch. All right. So first thing you do is you look at the pH. Is that pH acidic or basic? It's acidic, right? Then you look at your PO2 and O2, right? You got to give them some oxygen. Give them O's. Now you look at your PCO2 and your bicarbonate. Is your PCO2 high, low, or normal? It's high. So I hate to do this to you again, but with elevated CO2, that's going to combine with WAWA. It's going to form carbonic acid. And then the carbonic acid breaks down to hydrogens and bicarbonate. Yeah? So because the CO2 is elevated, it's forming more free-floating hydrogen ions. So this is a respiratory acidosis. You got me? Now, what's the only system that can compensate for respiratory acidosis? The kidneys. And if the kidneys were to compensate, how would they compensate? That's right. To compensate, what it would try to do is try to excrete more hydrogen ions and reabsorb more bicarbonate back into the blood. Say yes. So if that person's kidneys are compensating, what should you expect to happen to the bicarbonate level? It should go up. Did it go up? Is it higher than normal? So this is what's referred to as an uncompensated respiratory acidosis. This is something that you would see in someone who maybe has pneumonia, right? Or in the initial stages of acute congestive heart failure, right? The fluid starts building up in the alveoli, they can't exchange oxygen and carbon dioxide, but the kidneys haven't caught on yet. Yeah? All right, here, I'll give you one. All right, have that. Have at it. Oh. Anybody got it? Cannot even hear you. No? What was it? First of all, look at this for a minute. What is this? Acidosis or alkalosis? It's an acidosis, right? So, look at the PO2 and the O2 sat, give them some oxygen, yeah? All right, the PCO2, is it high, low, or normal? It's low, right? And I don't know how to get this to you. Think of CO2 as free-floating hydrogen ions. The respiratory system is getting rid of more carbon dioxide than normal. Because what's the normal? 35 to 45, right? So if you're getting rid of hydrogen ions, what should that do to the pH? It should make it go up, right? This pH is an acidosis, right? So what's happening? The cells through metabolism are making more hydrogen ions than normal. You got me? What's floating in your blood that can grab them and prevent them from being free floating? Bicarbonate. And when it does that, it's going to lock them up in carbonic acid. You got me? What's going to happen to the circulating level of bicarbonate, free bicarbonate, if the cells through metabolism are making more hydrogen ions than normal? It will go down. So in this case, did the bicarbonate level go down? Yes. So this is a metabolic acidosis. What's the only system that can compensate for a metabolic acidosis? The respiratory system. So if you're making more acid at the cell, and CO2 is an acid, you have to get rid of more acid at the lungs. Are the lungs getting rid of more CO2 than normal? You guys are not following this at all, are you? How many people honestly are following this? All right, I'm not even going to do it then.
What makes it compensated? The pH getting back to normal?
Yeah, the pH getting back. That's okay. Just forget it. Here, watch. This is what I'm going to explain to you, so at least you heard it. That's what they'll teach you. So, who might have tried to explain it to you? Watch. If the PCO2 goes up, that drops your pH. That's how respiratory opposite, right? Metabolic equal, meaning if your bicarbonate goes up, your pH goes up. If your bicarbonate goes down, your pH goes down. So if your PCO2 goes down, that your pH goes up. We'll leave it there. We're wasting time. But again, these are the things that they're going to expect you to know. All right? I tried. I'm good with that. Okay. There you have it. Did I do all the kidney questions? I did that. Right? Blood urea nitrogen and creatinine, you'll explain that? Remember that? Right? I explained that, didn't I? Did it? It'll take 2 seconds. Okay, here we go. Right? When you eat protein, yeah? Those proteins get absorbed into the blood, and the first place they have to go is the liver, right? And the liver takes that amino group and converts it to ammonia. And then it converts it to urea. And then the urea gets dumped into the blood. And because there's a little ammonia in there, right, it's called blood urea nitrogen, because urea and ammonia both contain nitrogen. Okay. All right, watch. That's a muscle. So you're making a muscle. Remember, you store creatine phosphate in your muscle. And when creatine is metabolized. It's metabolized to the waste product, creatinine. And then creatinine gets dumped into the blood and has to be filtered out by your kidney. So the two waste products that the kidney has to get rid of are blood urea nitrogen and creatinine. And because your muscle mass doesn't change, creatinine is the best indicator of kidney function because it doesn't change. Protein intake can change. So those are the labs. Now, watch. Hang on. Okay. What was that? Oh, I got it. All right. If you recall that the arterial blood is what's actually filtered by the glomerulus. And the three big things that should never be in urine because they're big and they're caught by the glomerulus are white blood cells, red blood cells, and albumin. Right? They're simply too big to get through the glomerulus and into the collecting tubules. Now, glucose is small, so glucose will be filtered. But that glucose, all of it, 100% of it, should be reabsorbed back into the blood. And the renal threshold for glucose reabsorption is 180 milligrams per deciliter. And if you're not diabetic, your blood sugar, regardless of when you've just eaten, should never be above 180. If it is, then the kidneys will not be able to reabsorb all that glucose back into the blood, and you will end up with glucose in your urine. So that's why they check glucose for urine. It's a real simple test to determine if somebody is diabetic. If you have glucose in your urine, then you are diabetic. That's the only reason you would have glucose in your urine, right? And the more glucose you have in your urine, the higher that will correlate with your blood sugar. Yeah? What's that?
What's the measurement on that, on glucose?
What? I didn't hear.
Is it something per deciliter?
Yeah, it's 180 milligrams per deciliter. Yeah. So what they do is, that's why when you go into the doctor's office, they'll do pee in this cup and they'll dip it. That's how they know if you're diabetic or not. Yeah? All right. There you go. Okay. All right. So today we're going to start the lymphatic system. Oh, am I recording this? Hello? Oh, I was recording this. Okay. All right, so here we go. Hello? Oh, yeah, that's working. Hang on. You guys want to take a break? Okay, go ahead. What is that going on? Oh, shit. Okay, guys, you ready? Do this, huh? So, from here on out, the rest of the stuff that we cover is going to be on the final. Okay? So you'll have your respiratory and kidney quiz, I believe it's April 3rd, right? Yep. And then the rest will be covered on the final. Say yeah. Okay. All right. So let me explain this a little bit. First of all, the immune system is extremely complex. I've had 3 classes in immunology. 3 classes. I'm going to try to explain this stuff to you in about an hour and a half. It is what it is, right? Okay. So, first of all, watch. The lymphatic system is intimately involved in your immune system. Again, what does immune mean? What does it mean? You're immune. If you catch a case and they say if you rat out your best friend in the whole wide world, you will be immune from prosecution. Right, you are protected. Right? So the immune system protects you. And how it protects you is by producing inflammation. Inflammation protects you. All right? How many people know, like say for example that you were a nurse in the ER and a patient calls up, hey, I twisted my ankle. What do I put on this heater? Ice. And you say ice, and then they say, why ice? And you say, that's what I was told. Ain't that right? Yeah? Somebody calls, I got a big boil on my butt. What do you put on it? Heat or cold? Oh, look it up on Google it. Do you know which one and why? Do you? I'm going to explain that to you. Okay? So, inflammation protects you, right? Watch. What's this? Phalanxis. What's phalanxis? No, what's the word phalanxis mean? It means protection. If you are prophylaxis, what are you? You're for protection. If you are anaphylaxis, you are what? You are without protection. And anaphylaxis basically is, write this down, it's a total body allergic reaction. Right? That's anaphylaxis. And when we get there, I'll explain that. All right? So, again, your immune system protects you, yes? And it protects you by producing inflammation. And I'll explain the process of inflammation. I was thinking about that last night, right before I went to bed. I'm not even playing. And I thought, you guys know inflammation and the signs and symptoms of inflammation, what produces it. You just don't know you know them, you know. And I'm going to show you that you do. Okay, so watch. How many people are in microbiology right now? How many people wish they weren't in microbiology right now? How many people wish they weren't in this class right now? Go ahead, I get it. I get it. Ready? People actually think that bothers me. I could care less. I get paid the same. What's an antigen? Come on, you had microbiology for cry eye. You talked about the immune system, though. Don't give me that. I'm not going to write that down. You can write it down. An antigen is anything that produces an immune response. Right? So is a sliver an antigen? Right? You get a little sliver in your finger, you get inflammation. Ain't that right? So that produces an immune response. What's a pathogen? That's right. It's an antigen that causes disease, right? You're not going to get a disease from a sliver, right? And the two most common pathogens that you'll encounter are bacteria and viruses. So, watch. Bacteria, they're like the 17-year-old kid who says to his parents, I'm out of here. They can live anywhere. You got me? There's bacteria all over that desk, all over that door handle. You can't swing a dead cat without hitting Pseudomonas aeruginosa or pneumocystic pneumonia. It's all over the place. The reason it doesn't bother you is because you have an intact immune system that's able to recognize it and destroy it. So that's what, watch. That's why bite wounds or puncture wounds are so infective. When you get a puncture wound, it doesn't bleed. And bleeding your own blood is good for you. So if you step on something or you cut your foot on some glass and it bleeds, it's going to wash out bacteria. That's a good thing. Puncture wounds, because they're small but deep, they don't bleed. That's why they're really infected. Tell me you got that. So bleeding, good for you most days. All right? Viruses are different. Viruses are the 45-year-old guy who still lives in his parents' basement. They can't live on their own. They need a host. And that host is you. So viruses, there's still an argument as to whether or not viruses are actually alive, right? Because they don't meet all the criteria for life. Basically what they do is viruses infect your own cells and then take that cell that they infected hostage and say, look, you're not going to do what you used to do. You're going to become a viral production factory. So if you are exposed to hepatitis B, the hepatitis B virus infects hepatocytes. And your liver don't do what your liver's supposed to do. It just becomes a production factory for viruses. Say yes. So that's why antiviral drugs there's very few and far between. Also, they're very toxic because they actually have to go in and remove that virus from those cells, and that's very difficult to do. That's why antibiotics don't work on viruses. Watch. If you got a really bad infection, the reason you got a really bad infection with a bacterial infection is this. Bacteria have all the necessary metabolic machinery to carry on life. So you get a little bacterial infection, B for bacteria. Yeah, are you writing that down? And then you got a cell, right? There's stuff in the blood that the bacteria needs, and there's stuff in the blood that the cell needs. So as the bacteria begin to replicate, divide, yes, they will overwhelm the cell, and the cell begins to die. That's why you smell rotting flesh when you get a bacterial infection, because it is dead cells trying to compete with the bacteria. Say yeah. Okay. So that's really the basic definition, and you can learn more about that in microbiology.
Question.
What?
So the virus just keeps overtaking the cell, and there's no antibiotics for it and stuff. Like, how do you essentially get rid of the virus?
There's specific cells that we'll talk about that. There's specific cells in the immune system called natural killer cells that they can identify cells that have been infected with a virus and attack them and destroy them. That's my favorite cell, too, natural killer.
Is that why, like, HIV is not, like, it's too fast, and that's technically a virus?
No, it's the fact that the HIV virus infects a particular cell of the immune system. It's helper T cells, CD8 cells. So you can't turn on your specific immunity when you have AIDS. So you become immunocompromised, and basically what happens is you die from normal infections that wouldn't hurt anybody else, but you die from them. The most common cause is pneumocystic pneumonia. They fill up with pneumocystic pneumonia, and their lungs collapse and they die. They can't breathe. That's what happens. All right, so if you're in healthcare, you know this. You have the blood-borne pathogens, yeah, which include HIV and the hepatitis series of B, C, D, and they found a new one recently, E. If they find another strain, what would that be, you think?
G2.
Right, or 6 maybe. Now, blood-borne pathogens, those have to be direct transfer of blood or bodily fluid. So if you're sharing needles with somebody that's infected, you can get it, right? If you are bumping ugly with somebody and not wearing any protection, you can get it, right? So the best thing to do to avoid these blood-borne pathogens is to read the textbook. Just read it. Don't worry about anything else. All right. Hepatitis B or hepatitis A is really fun. Hepatitis A, like after this class, you say, I'm getting out of this class. I'm going to take it online at Upper Iowa University. And you go to Jimmy John's to celebrate your decision, and the dude who's making your sandwich freaky fast, right? He goes, I got to take a dump. So he runs into the bathroom, he drops a deuce in the toilet, and he's got to come back and make your sandwich freaky fast. So he don't wash his hands so good. And he's got a piece of turd on his finger, and he wipes it on your sandwich. And that turd happens to be infected with hepatitis A, and you bite into it, now you got hepatitis A. So hepatitis A is transferred fecal-oral. That's why when you go into a restaurant, there's a little sign there. It says, all employees wash hands thoroughly before returning to work. They could care less if you bite into a crap sandwich. What they don't want is that crap sandwich infected with hepatitis A. It's bad for business. Tell me you got that. So, you know about that. Isn't that lovely? Yeah. And then if you've been exposed to it, or you're not sure you were exposed to it, then you got to go to the doctor, and they give you a couple shots of immunoglobulin A. I'll explain what that is, too. Okay, here we go. So, again, the immune system protects you, yes? And it does that through inflammation and specific immunity, which I will elaborate on in a little bit. Watch. Here's an arterial. 10 cc's of blood goes in there. How many cc's of blood leaves the venous end of that arterial? 10? Less than or greater than? It's less than 10, right? So that excess fluid that escapes the cardiovascular system and those small proteins, they have to go somewhere. And where they go is the lymphatic system. So the lymphatic system, another big function, is to drain excess fluid and small proteins that have escaped the cardiovascular system and bring it back to the heart. So all lymph vessels dump their lymph into the right side of the heart. So if you were to look at lymph vessels and compare them with arteries or veins, they're much more like veins. And I'll tell you about veins. There's no pressure, right? They have one-way valves, right? They take blood back to the heart, right? And the largest veins of the body are deep inside muscle. And how does venous blood get back to your heart? Contraction and relaxation of skeletal muscle and the thoracic pump. So, lymph vessels, no pressure. Right? They have one-way valves as well. They even have more one-way valves than veins. More. Right? And they don't take venous blood back to the heart. They take lymph. Lymph. Just say that. You should name your child Lymph. Hey, Lymph. Come on over here. Take out the garbage. That takes lymph back to the heart. And basically that's the plasma of the blood and the small proteins. So lymph literally means clear spring water. So go drink some lymph. Right? Have a bottle of lymph. Yeah. That's something you do on Saturday. Right after a hangover. What do you do? I'm lymphing around, man. Got nothing. Are you with me? All right. So the unique thing about the lymphatic system, it is only one way. All it does is take lymphatic fluid and small proteins back to the right side of the heart. Are you with me? Okay? And for the most part, wherever you have arteries and veins, you have lymphatic vessels. Now, you also have a huge lymphatic supply in openings to the body. And the biggest opening you have is your digestive tract. That's why about 70% of your entire immune system is near your GI tract, because that's where bad stuff can enter. And we learned in a couple of classes ago that one of the easiest and best ways for cancer to spread is through the lymphatic system. That's why cancers that develop in parts of the body that are open to the environment are very devastating. Yeah? Okay, very good. All right. Now, look. You know, and Easter's coming up too. You guys probably don't. How many people here are Catholic? Anybody? So we got 1, 2, 3. Okay, right. So you were raised on guilt and everything, right? I'm not even kidding. If you said it enough, wouldn't even have to say it that much. You could convict me of the Kennedy assassination. Yeah, I did it. I did. Anyways, watch. There's an 11th commandment. Yeah, they just found it 8 weeks ago. That 11th commandment says, thou shalt not get bacteria into the central circulation. If you get bacteria into the central circulation, you have sepsis. Do you want sepsis? No. So, watch. Watch. Better write this down. All lymph fluid gets returned to what side of the heart? The right side. But all lymph fluid must pass through a lymph node before it gets dumped into the right side of the heart. All lymph fluid must pass through a lymph node before it gets dumped into the right side of the heart. So think of lymph nodes as like security at an airport. It don't make no never mind where you're going or where you're coming from. To get your fatty acid on a plane, you have to go through security, right? So lymph nodes work like security checkpoints at an airport, and they will filter lymph. Say yes. And watch. Did I tell you the story about this girl that she got a new doctor, so the doctor had her do a physical? Did you know about this? I didn't tell you this? Anyways, she goes, Tim, is it appropriate for the doctor to tell you to take all your clothes off for a physical? I said, yeah. I mean, it's the first time you're seeing him or her? Yeah. So is it appropriate for him to sit like this and then tell me to bend over at the waist and walk towards him like that? I go, you got a pervert for a doctor. You need to get a new doctor. There's no reason for that. But here's the thing. People trust their doctor, right? They believe that they're not going to hurt them, right? And if they're doing it, there's a reason they're doing it. And some are perverted. Tell me you followed this, right? Why did I tell you that story? There was a reason for it. What? What's that?
Airport security, lymph systems, and you talk about the doctor.
Oh, I don't even know why. Boy, that was a weird one.
I'm sure it'll come back to you.
Yeah, it will. It all relates. All right. So, wait. Now there's a reason, and I can't. It was right there. I had it. I ain't gonna think that hard. Okay. Oh, that's why. Okay. Watch. If you have an infection in your hand, would it be appropriate for the doctor to feel underneath your arm? Why? Because there's lymph nodes there. If you have a sore throat, would it be appropriate for your doctor to be palpating down here? No. Tell me you got that. So that's how that story came about. So watch, because all lymph fluid has to go through a lymph node on its way back to the right side of the heart. The nearest lymph node that drains those lymph vessels, that's the node that's going to be involved if you have an infection. Tell me you got that, right? So if you have a leg infection, would it be appropriate to? Yes. You got a sore throat like I do now. I got freaking golf balls for lymph nodes here. So, what if I could play them? So, would it be appropriate for the doctor to do this? Yes. And tonsils are what? Lymphatic tissue. So they're right? So they're looking for tonsils. Tonsils protect the oral airway, right? The oral opening, and adenoids protect your nasal airway. Do you smell bad stuff? Yeah, pull my finger. Okay, yeah, that's fine. Write that down. 7 years. Yeah. You know why? Kids are obligatory nose breathers. Infants are too. You cut off a kid's nose, you pinch their nose, they don't know they can breathe through their mouth, and they'll suffocate. So if anybody tries that, you didn't hear it from me. Yeah. Suffocate a baby. That's 15 points of extra credit. It was worth it. As you're doing lifetime in prison and becoming Bertha's butt buddy. Yeah. Okay. So tell me you got that, right? Now watch. I'm going to teach you some medical terminology because I like you guys as far as you know. Lymphadenopathy means swollen lymph nodes. So if you see that on a medical chart, lymphadenopathy, that means they got swollen lymph nodes. Say yeah. Okay, watch. Where is it? That lymphadenopathy. Don't that guy look like, what do you call it? Lee Harvey Oswald? Don't he? Yeah. My neighbor. Okay, watch. Lymph vessels. Here's a lymph node, right? You have tons of afferent lymph vessels that enter a lymph node, but you only have one efferent vessel that will bring that lymph fluid, filtered lymph fluid, back to the right side of the heart. So the job of the lymph node is to filter antigens and pathogens. Are you with me? And I'll go over more of that in a little bit. But as you can see, they got the little one-way valves, right? So, got lymphedema. Lymphedema is blockage of lymph vessels and the inability of that excess fluid to get returned to the right side of the heart. Just real quick. There was a guy, his name is Ray. He's a salesman at the company. This guy is so good. He could sell you your own butthole. I'm not even kidding. Right here. You should try this. It's really good. Anyways, he comes out of the bathroom, and he's got blue jeans on. And he goes, Tim, look at my right leg. I go, yeah? What do you want from me? And then I left. His right leg was swollen from here on down, and his left leg was fine. And I asked him, how long has it been like that? He goes, for about a week and a half. So I said, let me draw your blood. And when I got the results back, his lymphocyte count was through the roof. He had lymphoma. And if I hadn't known that, right, that in congestive heart failure, you usually get bilateral edema. But here, he had edema all the way up to his hip. And one of the functions of the lymphatic system is to drain excess fluid and bring it back to the right side of the heart. But if those lymph nodes are producing tons of lymphocytes, it will block lymphatic flow. So one of the things that you always need to check out is unilateral, right, swelling of a body part, right? You need to have that checked out. So anyways, he got chemotherapy, and he's doing great now. He was actually on a commercial for Advocate in Illinois. And he goes, Tim, you saved my life. I go, what's in it for me? Right? So he did give me something. And he actually taught me something really important. Like when you go to those like festivals in the summer, cops are on the lookout for booze, right? So he got me these packets of booze that look like one of those Sunny Delight. What are they? Yeah, Capri Sun. So you could be sipping on that, thinking he's just, right. I'm having me a Capri Sun, buddy. Yeah, that made me very happy. Tell me you got that. Watch. Who didn't have my class for general? All right, who do I want to pick on? DNA, I'm going to pick on you, okay? Why did they tell you not to draw blood or take blood pressure in the arm of a woman who's had a radical mastectomy? Yeah, you do.
I remember you telling us that if somebody has edema, obviously not put a cuff or draw blood from that, because that's more of a calorie.
Yeah, something like that. But it's even simpler than that. There's a sign there. Don't do it. You ask nurses, you know what they'll tell you? There's a sign there. That's what they'll tell you. Okay, watch. I'm going to explain this in like 2 seconds. Ready? Here we go. When they do a radical mastectomy, they remove the breast, the underlying muscle, and the associated axillary lymph nodes, right? What do lymph nodes do? They're connected to lymph vessels. Ain't that right? And they filter all the lymph fluid that escapes the cardiovascular system and brings it back to the heart. When they remove the lymph nodes, there's no protection there. The best protection you have against infection is intact skin. When you draw blood, you've unintacted the skin. And because there's no lymph nodes to filter it, that little bacteria got direct access to the central circulation. So through a blood draw, they can become septic. That's why they're told, people who've had a mastectomy, they're told, you cut your hand, you better let me know. Ain't that right? See? And watch, if you put a blood pressure cuff on somebody's arm and you pump up the volume, look at that's a pretty good, look at that, that's a good cuff. And it'll make me have stethoscope too. There. Look at that. When you pump it up, you will cut off venous flow back to the heart. So the arterial blood goes down there. The venous blood don't come back because there's no pressure in the veins, and that will start forcing fluid out of the cardiovascular system into the interstitial space. How does that excess fluid get back to the cardiovascular system? Through the lymph vessels. Ain't that right? But now you have cut that way back. So any fluid that escapes the cardiovascular system remains in the interstitial space, Laura. Yeah. And they get a big arm. Look, lady got a big arm. That's lymphedema. That ain't going nowhere. So watch. After a woman has a mastectomy, they put a compression stocking on their arm. That's to increase interstitial fluid pressure so that it becomes greater than capillary fluid pressure and prevents the fluid from leaving the cardiovascular system. You know who'll explain that to you? Read it in a book. Good luck. One of the other things I'd like to point out is, look at the Timex. Look at that. That's a nice Timex. Boom. Did I tell you about Virginia Jackson? Yeah, I did. 65-year-old lady. She wouldn't get a mammogram, did I tell you? I never told you this. Real quick. She wouldn't get a mammogram, right? So I'm like, Virginia, you're getting a mammogram. I ain't having no machine squish my titty. That's exactly what she said to me. And I said, yes, you are. So I know the head radiologist at Lutheran General. I call him up. I said, hey, can you do me a favor? Can you get this lady in right? He said, Tim, absolutely. So I drove her down there, right? Waited for her, took her back to work. He goes, I'll read it right away. 4 or 5 hours later, he calls me back and he says, Tim, she has breast cancer. And I'm like, you're kidding me. And he said, no. So she underwent a mastectomy, and she was off of work for about 6 months. And when she came back, I got a little office, and every Friday she would put a pack of Twizzlers on my desk. She goes, Tim, you saved my life. And what did I say to her? Right, what's in it for me? So she was so appreciative, right? She'd write me. I'm like, come on, Virginia, enough. The Twizzlers, though, I'll take. So when he was, watch how I am. I'm just like you guys. Watch. I didn't do anything to deserve that Twizzler. But it happened like for 2 years in a row, right? Every Friday. There it is. Then one Friday I come in and I look and there's no Twizzlers. What was my first thought? No. Where's my Twizzlers? You got me? For doing nothing. Do you follow that? Right? No. She retired not too long ago. Yeah. She's okay. Tell me you followed that. Yeah? Okay. That's really good. So, watch. Here we go. You need to get this now. Where are the cells of the immune system formed? In the bone marrow. They're also formed in the spleen. Say yes. And they're also formed in lymph nodes. Say yeah. Now watch. All blood cells originate from one stem cell, a hematopoietic stem cell. Yeah. Are you with me? You're following this. And then they begin to differentiate. And they differentiate into red blood cells. Yes. White blood cells. And platelets. Platelets are little plates. Just like Piglet was a little pig. And then you have the lymphocytes. Are you following me? I'll show you a picture in a minute. what I want to concentrate on now are the lymphocytes and the other types of white blood cells. So here we go. All right, if you get this right, I'll give you extra credit. Where are white blood cells found? White blood cells. Go, that's very good. 0.00001. You should have known that. X points. That'll be a difference. I know you will. All right, watch. Watch. What does innate mean? You're what? Yeah, natural. You're born with it. That's very good. You're born with it. How many people were born with skin? Good. How many people were born with tears? How many people cried yesterday for no reason? You need to see somebody about that. That's weird. So, some parts of your immune system you are born with. You got me? You are born with skin, which is your best defense against infection. Tears, boo-hoo, right? When you get something in your eye, what happens to your eye? It tears up because it's trying to wash that something out of there. Saliva, right, got antibacterial properties. So those are the innate immunity. You're also born with white blood cells. Are you with me? And the white blood cells you're born with. And this is the order in which the most numerous types of white blood cells. You have neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So eosinophils and basophils are the lowest amount of white blood cells. The most numerous are neutrophils, followed by lymphocytes, and then monocytes. You got me? Now, this is how I try to explain it. These guys right here, the monocytes, the basophils, the neutrophils, and the eosinophils, these guys are like patrol cops. They circulate around your blood and lymphatic system, and they look for bad things. Tell me you got that. Who's with me on this? They look for bad things, antigens and pathogens, and then destroy them. These guys, the lymphocytes, these guys are the badasses. These guys, hang on. These guys are programmed. And they are programmed by actually coming in contact with an antigen or pathogen. So these are kind of like the Terminators of the body. Like Terminator, he just wanted to kill Sarah Connor, right? If they would have just got out of his way and let him kill her, boom, that would have been the end of that movie. Ain't that right? So watch. How you program these is by actually coming in contact with the specific antigen or pathogen that it is going now to be programmed to kill. Are you with me? So these cells, they have to be programmed. And how you program them is by coming in contact with that specific antigen or pathogen. Are you following me? Now, and I'm just going to tell you a few things. T cells kill directly. So once a T cell is programmed, that T cell, and I'll show you in a minute, kills things directly. It will come in contact with that antigen or pathogen and then inject it with some chemicals that will destroy it if it's a bacteria or a virus. B cells are a little bit different. B cells don't kill directly. B cells, when they come in contact with a specific antigen or pathogen, they produce specific proteins called antibodies. So antibodies destroy antigens. And the only way to get antibodies built up to a specific antigen or pathogen is to be exposed to it. So if you had a little baby, and you were home for the first 3 months and you went in there with Clorox and all that stuff and you cleaned your house from stem to stern and the kid, yeah, fine, right? Then you take them to the booger-infested daycare where every 2 seconds that kid is sick. The reason they're sick is because they've never been exposed to that stuff. So how you build your specific immunity is by being exposed to stuff. Say yes. And we're not there yet, but that's how vaccines take advantage of this specific immunity. Are you following me? So, watch. Who do you have? Who do you have? You got your patrol cops. Yep. The first guy on the scene are neutrophils. So observe. Watch. You following? Okay, watch. That's a tack. That's a big tack, okay? What's the best protection you have against infection? Intact skin. Where are the white blood cells located? In the blood. Where does arterial blood always go? My name is? The path of least resistance. Which is warmer, arterial or venous blood? Which is redder, arterial or venous blood? That's very good. I'm going to explain to you now the process of inflammation. When you get into clinical, your first little clinicy class, they start talking to you about the role of inflammation and the process of inflammation. And they tell you that it is, the area is red, warm, and edematous. You're going to know why. Ain't that cool? All right, here we go. Wait. Watch. I'll come back to this. Wait. There's a question on the final. Explain the process of inflammation. Guess what I'm going to do right now? I'm going to explain the process of inflammation. Listen up, because this is true. Throughout your body's tissues. Really? You got me? Embedded in those tissues are cells called mast cells. And mast cells contain a chemical called histamine. Are you with me? Histamines do two big things. Number one, they cause massive arterial vasodilation, MAVD. Yeah. And number two, is they cause increased capillary permeability, or how I like to say it, increased capillary leakiness. They make the capillaries more leaky. Are you following me? Okay. All right. Ready? Hang on. Watch. White blood cells, the patrol cops, neutrophils, they have the ability to squeeze through small cracks in the capillaries. That ability of white blood cells to move outside of the cardiovascular system and into the interstitial space and squeeze through small cracks is called diapedesis. That would be an excellent name for a rock group. Let's hear it for diapedesis. Don't you think it would? I'm using that. Yeah. And their new hit, Slow Motion. I like it like that. She's working that back. Diapedesis means these white blood cells have the ability to to squeeze through small cracks and identify and locate antigens or pathogens. Are you with me? You're following this so far? Yeah? White blood cells also release chemicals. These chemicals that white blood cells release, there are many. Number one are prostaglandins. We're familiar with that, aren't we? From fetal circulation, remember? So prostaglandins do a lot, right? And interleukins, you with me? And watch. Heparin. What does heparin do? It causes you not to clot. Tell me you got that. Do you want an owie to bleed if you got stabbed with a knife? Do you want that owie to bleed a little bit? Was there bacteria on that knife? Who knows? Maybe before he stabbed you, he licked it. There. So you want it to bleed. So heparin will actually prevent the blood from coagulating so that you bleed a little longer than normal to wash out any potential antigens or pathogens. Do you follow that? Do you see this? Guys? How many people are following this? Okay. Now, a couple of things about prostaglandin. Prostaglandins do several things. They will increase the vasodilating locally. You got me? Number two, prostaglandins stimulate local Knoxial receptors. What does Noxy mean? Noxy means pain, right? So these are pain receptors. So prostaglandins increase, they amplify the inflammatory effect, and they will stimulate local pain receptors. Now, pain is diagnostic. Pain tells you something's wrong. So if you go to the doctor and you say, "Doctor, it hurts when I do that," and the doctor says, "Don't do that," that's good advice. So pain is going to cause that joint or whatever part of your body to be immobile. If you got a broken ankle, that pain is going to prevent you from walking on it and making it worse. Do you understand that? And watch, the amount of pain that you have is directly correlated with the amount of tissue damage that has occurred. So the more pain, the more tissue damage. Are you with me? All right. Are you ready? Where are white blood cells? In the blood. Where does arterial blood always go? The path of least resistance. So here we go. I'm going to explain to you inflammation, and you're going to like it. Maybe not. Probably not. All right, so watch. Wait. Hang on. So somebody doesn't like you, so they take a broken broom handle, and they stab it into you, and these little green things appear to be Tic Tacs. Those are bacteria on there. What's the best protection you have? Intact skin. So you've damaged that tissue. You are going to get inflammation. Are you with me? So mast cells right here, when you damage tissue, rupture the cell membrane of that mast cell, and they will release histamine. Say yes. Not shown in this video, but it's still pretty good. Are you with me? What do histamines do? They cause arterial vasodilation, and what happens to the capillaries? The capillaries become leaky. Here we go. This is a good video. I look at this late at night. No, that's not disturbing. All right, so here we go. Then you got little bacteria. You got mast cells. I'm going to skip this part. Watch. Well, come on, you son of a... Okay. Ready? See, it's throbbing right now. Okay, you got some histamine release. What do the histamines do? Cause it to dilate, and then you start to develop those little cracks, right? Now, watch. Watch. And I told you this before. I'll never forget it. Arterial blood flows in a laminar fashion. So the watery part of the blood flows on the outside, and the formed elements flow on the inside. You got me? So with histamine causing these little cracks, these little holes to be leakier, plasma, right, is going to leave that capillary. What that's going to do is it's going to allow the formed elements to come closer to the edge of the capillary, and they will actually bind to the capillary membrane. White blood cells will. Are you following this? So you want that swelling because you want to reduce the volume of fluid in the capillary so these white blood cells get closer to the capillary wall. When they get close enough, they'll bind on, and white blood cells have the ability to move. They have the ability to squeeze through those small cracks. And when they do that, they can get into the interstitial. Oh, some of them. All right, hang on. All right, so watch. Hang on. There we go. All right, little vasodilation. Arterial blood, red and warm or cold? So because it's red and warm, what's going to happen to that area of damage? It will become what? Red and warm. Because more arterial blood's going there. And because the capillaries become leaky, what's going to happen to the amount of fluid in the interstitial space? More, so the area will become swollen. So what are the signs of inflammation? Red, warm, swollen. Say yes. So watch. Where's the bacteria, the little Tic Tacs? Right here. Where are the white blood cells? In the blood. They got to get out of the cardiovascular system and into the interstitial space. they can squeeze through those little cracks through the process of diapedesis, and they will go and they will attack those bacteria. Why do they attack the bacteria? What? Say what? How do they know it's foreign? Watch. Embedded in all of the cells of your body is a group of proteins called the major histocompatibility complex. The major histocompatibility complex allows your cells of your immune system to identify you. You got me? Do bacteria have the major histocompatibility complex? No. So that is how white blood cells know to attack it and destroy it. Tell me you got that. And the reason it doesn't attack your cells is because you have that on there. Now watch. Once a white blood cell, a neutrophil, comes in contact with a bacteria, it will begin to release those other compounds of inflammation, interleukins, prostaglandins, histamines, and heparin. Are you following me? Prostaglandins, interleukins, right, even to some degree histamines, are called chemoattractants. It's like putting down breadcrumbs or leaving a crumb of, dog biscuits for your dog. The dog follows the trail. So when they come in contact with those bacteria and they eat it, they get turned on, they release these chemicals, and they say, okay, other white blood cells, get your fatty acids over here. Tell me you got that. And that's the area that those cells, those white blood cells, will form. So when you pop a zit, you're popping neutrophils. Can't come to class, got to pop some neutrophils. So that you get the inflammation, you get a zit, it's red and it's warm because of the inflammatory process. Say yes. You got that. Now, watch. Where are the white blood cells? In the blood. So if you have an infection, do you want more white blood cells going to that area? Yes or no? Good. What does heat do to arteries? Where does arterial blood always go? That's why if you got an infection, you're told to put heat on it. Yeah. And I know what you're going to want to say, and don't ever say it again, because you learned so much in this class. Well, most of you. Watch. It's not to draw it out. It's to increase arterial blood flow, which contains the white blood cells that will destroy it. That information is so good. I just feel good about myself, even though I'm sick. I know this is rock solid. I had a long talk with myself about that. I can't worry about that stuff. Who cares? Okay, now watch. Watch. So if you got a boil, what do you do? What do you do if you got a boil? You put heat on it. Okay? Watch. Hey, let's bring this back. Hang on. Hang on, get this splinter out of the way. Okay, watch. Here's some cells. Summing up. Watch. These are healthy cells. You got me? All of these are healthy cells. Now, let's say, for example, that you were at home, and let's see, your book was on top of the refrigerator, covered with dust, and as you try to pull it off, it falls and hits you on the foot, right? It is going to damage your own cells. Do you follow that? Do you have an infection because your book hit your toe? No. You have damaged your cells. Now watch. Healthy cells contain prostaglandins, interleukins. Tell me you got that. Are you with me? And when you damage tissue, you also rupture mast cells. And those release what? Histamine. And we know what histamine does now, huh? Now watch. If your cells are healthy, where are the prostaglandins, the interleukins, those chemoattractants that will attract white blood cells to that area? They should be inside the cell. But if you drop a book on your foot, you will rupture the cells. And where do the prostaglandins and interleukins go? They go into the interstitial space. Say yes. And because you ruptured mast cells by damaging your own cells, you get the release of histamine. And histamines cause massive arterial vasodilation. Say yes. What happens to that area? I'll just tell you. It becomes warm and red. What does heat do to the rate of diffusion of molecules? It increases it. Now watch. These white blood cells, these neutrophils, they don't look and say, hey, that's a damaged cell. They look for the chemicals that are floating around by its cell membrane. Do you follow this? How many people are you? Yeah or no? Let me just finish this and you can go home. No one's listening now. It's true. I got to do it, though. I just won't look. These white blood cells, these neutrophils, are going to look for chemicals. These chemicals, these chemoattractants. You got me? If you don't put any ice on it, that area will become warm, and these chemicals will start diffusing around to healthy cells. And white blood cells don't see, oh, yeah, that's a healthy cell. They see the prostaglandins, the chemoattractants, and they know that any cell that has chemoattractants, I destroy. So what will happen is you will start destroying. You'll be getting rid of the damaged cells, but you will also start attacking and destroying healthy cells. That's why if you don't put ice on it right away, it will take longer to heal because you're destroying healthy cells as well. Bruising is a result of damage to blood vessels. And the bruising is actually the result of the heparin preventing the blood from clotting. That's why the blood will move to the most dependent area. So if you've got a busted up ankle, the bruising starts going to the lower part of the foot. Say yes, you followed that. Tell me that made sense. It makes perfect sense. So the rule of thumb, and now you will never have to remember it because you will know it as far as I know, is that if someone calls and I got a boil on my butt, you tell them to put what? And if they sprain their ankle, what do you tell them to put? Now you know why. Isn't that wonderful? Good. Go ambulate home now.
Why do after somebody like sprains their ankle or their leg, sometimes they say alternate IT?
For the same reason. And as far as alternating ice and heat, I don't recommend that. Usually the first 24 hours, you should put nothing but ice on it for the reason I just explained. But afterwards, usually like 24 to 72 hours, you can alternate the ice and heat because the immune system has kind of done its job already, but the effects are going to be, they're going to take longer. And that's why you've, forget it. You'll learn that. Okay.